Hi, everyone. It's Dr. Ozzy here. Welcome to the More Than a Pretty Face podcast. Hi, everyone. I'm Dr. Ozzy, a board certified dermatologist. Welcome back to the More Than a Pretty Face podcast. I'm here with my co-host, Lacey.
Hi, how are you?
Good. What's going on?
Oh, today I'm going to ask you 100 questions.
100 questions.
Oh, yeah.
What do you mean?
We get so many
You have time
questions
for this?
on Instagram
Oh,
and our emails. So we're going to shoot through them, okay?
all
Quick,
right.
quickly.
Quickly.
Don't
okay.
make me say Kentucky.
Oh, okay. I'm usually guilty of that.
Yes.
Well, Lacey, do you have a beauty and blemish?
Of course I do.
Guys, for those of you who are new, beauty is the best things that are happening in our life, and our blemishes are the not so great things that we want to just conceal.
Yes. Well, my beauty is the fact that we're famous.
What?
Yes. Okay. We have been in Cosmo
Yeah, that's pretty cool.
for our UV clear powder brush.
Yes,
That's
true.
amazing. And the one in Hydratint BB cream was an L.
Yes, as one of the best BB creams. You know, I
Yes.
was like shocked by this. These editors actually requested the product. They reviewed a bunch of products. So I had nothing to do with it. I didn't even know it was coming out. It was an independent review, which makes it I'm just like pinch me moment.
We literally, and then the BB cream was also in Glamour.
Yeah.
I
know.
literally grew up reading these magazines.
I know, me
And
too.
we're in them. So that's my beauty, that we're
Aw, you're the
famous. But I will say my blemish is all of the paperwork and desk work that I've been doing lately. I am
No.
like so stressed and like tense. I didn't sign up for this.
I
When
know.
I became a nurse, I didn't expect to do so much desk work, but
Well, you should get Trap-tox.
what? Say that again.
Trap-tox.
Trap-tox?
Yeah, if you're tense,
What kind of
like in your
trap?
shoulder right here.
Oh, like my
Yeah,
muscles?
your trapezius. Well, that's the kind of trap I'm talking about. What kind
I
of
was-
trap do you think?
I mean, I was going to take it to a whole nother level. Not safe for the podcast.
Yeah. No,
So tell me more.
Trap-tox is when you inject Botox, which goes into a muscle and relaxes the muscle. Because this is
Oh,
what's happening to everyone.
yeah.
And I saw this picture of what our society and what our body is going to look like in like 20 years.
Oh, no.
You know, with all these things that we do on our devices now, we're walking around like this
Yes.
with our head over our body, looking down. Well, guess what? That puts so much pressure and tension on your spine, on your back, on your neck. Tech neck
I was just
is
gonna say.
real. Tech neck is absolutely here to stay. And so when that happens, your trapezius muscle and your neck muscles, they have to support your big head. I mean, not that your head is big, but like everyone's head, you know,
I know I have a big forehead, but I have a whole big
Evolutionary.
head too.
evolutionary wise, our heads are not supposed to be down all the time. I see this in my kids. And you're supposed to hold your head up in line with your spine so that the weight gets, distributed evenly. But when you're walking around like this, you're going to get pain, tension, in the trapezius muscle. And so by injecting Botox, it also helps elongate your neck and kind of diminishes that muscle, relaxes the muscle. So it can potentially help with migraines, neck pain, tech neck, and it can make you look taller and your neck longer.
Okay, so when are we going to do that for me?
Yeah, we could do it. I don't know. Let's do it this week. I
Okay.
need to make a video about this. But yeah,
I
so
love
it's trending. I know everyone's kind of talking about it, but that's what it is.
Okay, I love
Yeah.
that. Okay, well now my questions are answered. I can't wait to try it. How about you? Do you have a beauty and a blemish?
Well, I guess my beauty is that I found my people.
I thought I was your people.
You're my people, but I have other people
Who else are your people?
that are skincare addicts. So
Okay.
did you know there's a Reddit and it has 2 million followers or subscribers. It's called Skincare Addiction. And I have to say, I love
Oh.
how these people are into skincare and wanting to learn more and always looking out, about about what's the latest products and what's happening in the skincare world. I found this group through a patient that came in.
Okay.
Unfortunately, she came in with toasted skin.
Oh.
she she
Oops.
poor thing. You know, we all have these people all have the best of intentions,
So is it
but
like a blog?
it's
Like what
sort of
is
like a
it?
blog, like a thread, no pun
Oh.
intended, on Zuck's new venture. But yeah, so it's you know where people go to find information. The problem is
Oh.
there are not any dermatologists on there. It's just, hey, I tried
Anyone.
this product, I did this, and it worked great. And next thing you know, you have all these people doing it, but how do you know that that's the right product for
Right.
you?
Yeah.
And so she went on there looking for advice for, skincare regimens and so forth. And somebody had raved about Paula's Choice 2% BHA, which is a great product. Okay, don't get me wrong. And it's very popular. You've probably seen it all over TikTok.
Yes.
And it's 2% salicylic acid. And, the instructions do say apply it twice a day, every day. And so she was doing this, applied it on top of her retinol, her vitamin C, her
Oh.
copper peptides, her niacinamide serum, all these actives. And oh my goodness, she came in. Her skin was red. It was peeling. It was itchy. It was uncomfortable. She's like, wait, this is not giving me glass skin. It's actually making my skin rough, old
Aw.
looking, and I'm seeing more wrinkles more than ever. Well, guess what had happened?
What?
She basically over exfoliated, damaged her skin barrier,
Oh.
and her skin was just a complete mess.
Okay, so for our listeners, what is a skin barrier?
So, skin barrier is the key to healthy skin. I always say it's what keeps the bad stuff out and the good stuff in. And if that gets disrupted, then all hell breaks loose
How do you
because,
do that?
well, one is overexfoliation. On the average person, like somebody in their, 30s, 40s, and beyond, doesn't need to exfoliate every day. Now, if you're a teenager and you've got acne and you got the super oily skin, then yeah, a 2% BHA at Paula's Choice would probably work twice a day, especially since you hopefully are not on any other actives because you're a teenager and you got better stuff to do and you just don't have time. So in that case, if that's the only active you're using and you're not really using anything else and you're, a teenager, so you got a lot of oil built
Yeah.
up, so that's great. But for majority of people, that's too much. And the skin barrier is sort of the outer layer of the skin. And you do want to exfoliate the dead skin that's even further out than that, but your skin barrier is your moisture barrier, and without it, it causes a lot of disruption. It's like, bombing a village, if you will.
That's horrible.
That's horrible, but I think, as a child, I grew up in the Iran-Iraq War, so that would be the whole horrible thing. Like if I was a skin village, that was maybe a bad analogy, but this is where you say Kentucky.
Okay, well,
Anyway,
on to better skin barrier. What
that
do you
was a little
do?
exaggerated.
Happy
But
Monday, you
anyway, so
guys.
yes.
So that's why I really like intense recovery. We'll just rub it all over this situation right now.
Yeah, this is not. This was not meant for the Western world. I'm sorry. Okay, so back to the skin barrier. So yeah, so the skin barrier is really key. So what do you do if you do, bomb the village and disrupt your skin barrier? Well, for one thing is you want to stop all your actives. And really, your skin is pretty highly functional. You don't need all these things that we feed it in our overconsumed developed world. And so you only really need a gentle cleanser and a moisturizer. And then, maybe the BHA once or twice a week,
Okay.
as an exfoliant. You
But
don't,
once your skin's calmed down.
yes.
Yeah.
So you want to take a break from your actives for 2 weeks. Just stick with a gentle cleanser. I love the Soothe cleanser, which is sulfate free. It's super gentle. We use it post laser because when we do lasers, we also disrupt the skin barrier. And so that is a great one for, skin that's sensitive or compromised. And then your skin just heals itself. It's highly functional, but it may take 2 to 3 weeks. So you got to
Yeah.
stop everything.
Yes. I know patients hate to hear that.
I know, because nobody has 2 weeks.
Nobody has
Come
2
on.
weeks.
Like, I got something like in 2 days. Hand it to me in 2 days.
Yes. All right.
So we helped her through. We put her on the barrier duo, the skin barrier duo, which, she cleared up
I
and
love
she was
that.
happy. I was happy. But she learned her lesson. We all make mistakes.
We all make mistakes. So are you ready for Ask Dr. Ozzy?
Let's do it. 100 questions. Let's go.
Well, we're here for our community. We're here to help you guys. Any questions, any skincare guidance you guys need, don't hesitate to email us at morethanaprettyfacepodcast@gmail.com, or you can DM us at morethanaprettyfacepodcast. So let's jump into it. We have, like I said, hundreds of questions. So here are some examples of just the questions we've gotten the last month. Okay, so just an example of some of the questions we've gotten over just the past month. Just the past month. Best cleansers, dry skin, vitamin C, like, I don't know, should you do it? What kind of creams for fine lines? Can you start a new skincare line all at once? What do you suggest for melasma? Oh, so many questions. And the reason I'm overloading you right now
Yeah.
is because you are so great and empowering on just simplifying skincare. And I just want to hear your thoughts on you just telling us the very basics of skincare,
The foundations.
the foundations.
I love that because I think more people need to understand this.
Mm-hmm.
And it would make my life easier because I see a lot of you coming into my office with this problem.
Yes. And then we'll get back to the questions.
Sounds good. Let's do it.
So, what do we start with?
So, simplifying. Really, every great skincare regimen has 3 steps: cleanse, treat, and protect. The treatment portion should be customized based on 1, your skin type, but 2, your skin concern. Because some people might be concerned with acne, or some people might have hyperpigmentation. Some people may have acne and want to do something for anti-aging. So it's really unique to every individual person. Now, the cleanser is not as critical because the purpose of a cleanser is really putting it on, cleaning the skin, and rinsing it off. It's not really going to do a whole lot unless it's a medicated cleanser. In that case, you have to leave it on the skin for at least 30 seconds for it to have any effect. So that's cleansing. The moisturizer is really to protect the skin, to restore that moisture barrier, that skin barrier we talked about earlier, to help strengthen it, to maintain it, all these things. So those sort of stay the same, and they can be basic. They don't have to be uber expensive or uber fancy. Your investment piece is that second step. It's that treatment portion that you should really pay attention to. In terms of cleansing, people ask, well, do I cleanse in the morning? Do I not cleanse? That's like a big topic right now. Is Salma Hayek went on there and said, oh, my secret to my skin is not her genetics, but it's I don't cleanse in the morning.
Oh,
so
that's why
it
she's
started
gorgeous.
this whole wave, and I love her. Like, her social media is so fire. I love her and everything she stands for. So of course, everybody's now skipping cleansing because she said that, which is fine. You don't necessarily need to use a cleanser in the morning. You can just use water because your cleanse should really come at the end of the day. And you don't want to over cleanse because it will dry your skin out, which then leads to that skin barrier problem.
Well, I'm glad you're talking about cleansers because I want to know more. Should we double cleanse at night?
So double cleansing is recommended, particularly if you wear sunscreen and makeup, because you really sometimes don't get all that off with a single cleanse. There are some cleansers that are really great if you want to do a single cleanse. Like, I love the Purify cleanser because I apply it, like, if I'm really lazy and I don't want to double cleanse, I apply it to dry skin, almost like a lotion, and it feels like a lotion. It's got this silky texture, and work my makeup off, and then I rinse it off. So that's an option of a cleanser that would function as as close you can get to a double cleanse. But double cleansing means that you first use an oil-based or a surfactant-based product to get makeup and oil and debris off,
So
because
you
again,
like
oil attracts oil,
so you
you
like
know.
oil cleansers.
Well, I like them in the winter. In the summer, I prefer something lighter, like micellar water is great for summer because it's lighter.
Okay.
Because oils in the summer, the humidity sometimes can cause a buildup in your pores. But oil cleansers are fine in the summer too. It's just mostly a preference. But you can use that to work off the makeup, the sunscreen, and then do a second cleanse with another gentle cleanser to get everything else that is still on your skin. So that's the definition of a second double cleansing. And I have actually an entire YouTube video dedicated to double cleansing. So go
Okay.
check it out if you want to learn more.
So if you double cleanse at night, you don't think like morning cleansing is necessary per se.
I still use a gentle cleanser in the morning sometimes, but if I do feel like my skin's really dry, then yeah, just use water.
What do you think about the same cleanser every single night,
Because
or
you
should you switch it up?
drool, or I don't know, you like
You drool.
I mean,
Speak for
you
yourself.
might like sleeping on your face, and then I don't drool, but some people might. So yeah, I don't think it's a bad idea as long as your skin tolerates it. But your cleansing is most important at the end of the day, because clean skin is healthy skin.
Yes.
And if you're not cleansing, you get all that buildup that gets compacted into your pores, and then your pores stretch out, and it can interfere with other products getting into your skin. So it's really
Okay.
essential.
So switch up your cleansers or do the same cleanser every night.
I would say keep it simple. Honestly, just use the same cleanser in the morning and night. A gentle cleanser works with 95% of regimens, I would
Okay.
say.
Okay. What temperature should the water be when we cleanse?
I would say lukewarm. Now, sometimes I'll use cold water, like if I'm feeling really puffy and
Mm-hmm.
inflamed, that cold temperature can help. Definitely never use hot water. That totally damages skin cells, dries you out, and really sucks out all the moisture from your skin.
Can it make you more red?
Yeah, I can.
I'm really red.
Yeah.
Do you like washcloths or hands?
Again, simple. Hands are perfectly fine. Just make sure your hands are clean. I am not a fan of those cleansing brushes.
So no cleansing tools.
You don't really need them.
They're
Plus,
aggressive.
they're aggressive. Those bristles can cause little micro tears in the
Mm-hmm.
skin. And if you have rosacea and you're prone to broken capillaries, they can actually trigger more broken capillaries to come out. If you've got acne, like inflamed acne,
Mm-hmm.
friction and rubbing actually worsens inflammation. So I'm not a huge fan. One, you save money. Two, they can build bacteria and yeast in those bristles. I always just imagine them growing and having a party in my bathroom.
Gross. Okay, so let's talk about the treatment. And remember, quick answers, okay? Don't make me say Kentucky. Um, does your face have to be completely dry, or should it not be when you put on your treatment product?
So damp skin will absorb whatever product you're putting on it much more than dry skin. So if you're using a hyaluronic acid serum, for example, or a
Mm-hmm.
serum with hyaluronic acid, you want your skin damp, because hyaluronic acid likes water, wants to bind to it, and it just works better at hydrating. If you're using a retinol, you
Mm-hmm.
probably don't want to put it on damp skin because it's really going to absorb and you might get irritation. So wait and apply it to dry skin.
What do you think about active ingredients? Like, how many is a safe number to use? What's too many? What shouldn't be
Yeah, I
together?
highly encourage you to look for products that are comprehensive. So, some ingredients that should never be used as a single active product ingredient is niacinamide. Niacinamide is in so many products, you don't need it as a single ingredient product, especially if it's over 5%. So use your products with multiple actives that go well together, that saves you on steps. And so
Perfect.
if you're using, for example, a vitamin C serum, it probably already has hyaluronic acid in it and ferulic acid, which are antioxidants. You don't need a standalone product that's just hyaluronic acid,
Mm-mm.
honestly.
What is Illuma-C used for?
So that's a vitamin C serum. It's 15% ascorbic acid, which is the pure active form of vitamin C. So I love it for discoloration, anti-aging. It helps brighten the skin. and it does have hyaluronic acid in it. So that I do apply to damp skin right before I apply my Hydro BB.
And that differs from the glow serum how?
So the glow serum is really designed for sensitive skin or people that have a hard time, with their skin microbiome. And it is a combination of L-ascorbic acid and a new vitamin C analog that's called tetrahydrodecyl
Say that
THD.
5 times
It's
fast.
THD, and it is, a more stable analog of vitamin C. It's less irritating, it penetrates deeper. There's a lot of vitamin C, analogs and precursors that are not the active form that just simply don't work. But this new one has so much science and research behind it. And we've tested the glow serum on so many levels that it is effective and a great option if you can't tolerate the
My favorite.
active form. Yeah, I know you like that one.
What's azelaic used to treat?
So azelaic acid is actually great for a number of conditions and concerns. I call it the jack of all trades, but the master of none, because you can use it for so many conditions, but it's not overbearing. So you can use it with other actives and it's not going to, you know, traumatize your skin.
It's like a
And
gentle
yeah,
exfoliator,
it's a
right?
gentle exfoliant. It helps with hyperpigmentation. It's great for rosacea. It's my go-to for rosacea. I love it for perioral dermatitis. I love it for acne. And if you're pregnant, azelaic acid is considered one of the safest ingredients in pregnancy. So it is a jack of all
I
trades.
love
And,
that.
you can add it into your regimen. But again, don't go overboard with actives.
What is Lift and Renew used to treat?
So Lift and Renew is actually a great anti-aging serum. It's a combination of a retinol and bakuchiol. And why would you combine two very similar ingredients together? Because they both help with texture, lines. They help with, collagen stimulation. Well, because bakuchiol is anti-inflammatory and it sort of makes the formula more gentle, yet enhances its efficacy.
Yes.
So we have a formula that is just as effective. We actually did studies on this, guys. We took samples of skin from people that were using Lift and Renew and compared it to people that were using tretinoin, which is prescription retin-A, 0.025%. And it works very similarly. We got the same results, but guess what? The people that were using Lift and Renew had less irritation.
Yes.
And probably, they were able to use it more often and the results were very similar. So that is a great combo because it makes it less irritating, yet you get all the benefits. And I love that the bakuchiol oil, it kind of gives your skin a nice glow. When you first put it on, your skin gets a little red, but then that goes away. It doesn't get itchy or anything like that. It just gets a little, almost like a little pink.
Yeah. Which
But
is
yeah, so
natural for me.
retinol is the OG of anti-aging. And the reason being is we have so much science and data to support it stimulates collagen. It produces hyaluronic acid in your skin. It boosts your skin's circulation, helps with pores, lines, texture. The list goes on. And when I want to do a laser resurfacing on someone in my office, I want to retinize their skin.
Yes.
And we know what that means as a dermatologist. I want to make their skin healthier, more efficient. So when I do disrupt their skin barrier, they heal faster, their results are better. So there's nothing that really comes close to retinols when you are, talking anti-aging.
You're so nerdy. I love it. What is Dermabright pads for?
I love Dermabright. Well, one, these pads are very unique to our practice because we mix them fresh in our office with every single order. They come as 60 pads, and it's a combination of all these natural skin brighteners. So arbutin, berberry, vitamin C, emblica. It also has kojic acid, which is one of my favorites. And so it's a great, just easy to use, toner that helps brighten the skin. So it's great for hyperpigmentation. You have the option of adding hydroquinone. I know hydroquinone gets a bad rep, but it's really effective for melasma, hyperpigmentation. So you can add 2% hydroquinone as an option in these pads. So I love them in the morning. You can use them once or twice a day, and I find them to be pretty gentle. So, see, you get all these actives in the one product. You
You don't
don't
need.
need a gazillion products sitting on your shelf and a gazillion steps. Trust me, your wallet will be fatter and your skin will be happier.
What do you think about chemical exfoliants versus treatment products like we're talking about above?
So, chemical exfoliants, like I said, you only need to exfoliate the skin once or twice a week at the most. You don't need to really go any further than that. Treatments are, if you've got rosacea, for example, then you want to treat with something. If you've got acne, then you want to use, it depends on the type of acne you have. So you see, so it gets very complicated. And if you've got hyperpigmentation, you want to treat those specific concerns.
Okay,
Now,
Kentucky.
okay, so then what you want to do is skip your exfoliant the night that you are using, your treatment. So just exfoliate once a week and skip your treatment.
Okay, don't forget we
One
have a
or the
hundred
other.
questions to go
Okay,
through.
I'm sorry. Okay,
Okay,
I'm back. I'm back.
should which serum should be used sparingly?
Sparingly.
Yeah, like don't
Hyaluronic
overdo
acid
it.
because it's in everything.
What about like your glow serum?
Glow serum. Well, that you should use that every day in the morning
I
if
guess
you want to
sparingly. I
glow.
guess when they asked about that, I thought maybe like per use, like how much, how
Well,
many
okay, so
drops.
so retinol, you got to be careful how much you use because it's potent. The more you put on, the more product that's going to get absorbed
Hmm.
and the bigger the reaction. So it's a tricky beast. The powerful ones you don't want to overdo.
Okay, let's talk about protecting. Okay.
Protecting the skin.
Yes.
Yeah. So we said cleanse, treat, protect. What does protection mean? In the morning, it should be a moisturizer with a SPF built in. And now we're getting so fancy with skincare products. I mean, Hydro Temp BB was sort of the OG. It was the moisturizer with glycerin and hyaluronic acid, and it had an SPF 44. But now there's a lot of moisturizers that have SPF in it. You don't really now need to moisturize and then use an SPF cream. You can get one that's all in one. Now, if you've got super dry skin, it's fine to also moisturize, but you got to be careful with layering. We talk about this. The skin is highly functional. You don't want to layer 1,000 products on it. It's first of all, it's not gonna get absorbed, right? After layer 2 or 3, forget it.
Forget about
Okay,
it.
forget about it. Now you're just like, I don't know, it becomes like this hodgepodge soup or something on your face.
What different moisturizers would you recommend per like skincare, like skin
So if
types?
you've got oily skin, look for a gel-based moisturizer. Like I love this one by Aveeno. It has oats in it and it's super light. And so that gel moisturizer is great for oily skin. If you've got sensitive skin, look for ones that have the minimal amount of ingredients and nothing fancy, right? So don't get a moisturizer with like stem cells and like, kojic acid, niacin. Don't go for that if you've got sensitive skin. Like Vanicream is a skincare line that makes great moisturizers for sensitive skin. Now, if you've got combination skin and you've got normal skin, well, the world is your oyster. Like you can like use pretty much anything you want. You can use fancy stuff like Caudalie that may have a little fragrance in it, and you'd be fine. So, it becomes personal. Yeah, moisturizers, they all have a certain feel. Some are really heavy.
Okay. So, do you change your moisturizer throughout the year? What are you
Yes,
thinking?
that's a great question. You should lighten things up in the summer because the humidity and it's warmer, so you don't need necessarily heavy moisturizers. Look for ones that are more, serum based or lighter rather than heavier oil based. Now, if you happen to be at the beach all day, your skin's feeling dry, you can pull out that heavier moisturizer. So listen to your body, listen to your skin. It's not a bad idea to have a couple of different ones, maybe a gel base for summertime, an oil base that's heavier for the winter.
Yeah, I like intense recovery in the summer and restore in the winter.
Yeah.
That's my go-to.
I love Restore because I need to age. I need to fight aging. And it's my go-to anti-aging one. So while we're talking about skincare regimens, I hope I didn't confuse you or overwhelm you with the amount of information because it can be overwhelming. to know how to put a skincare regimen together.
Mhm.
So we at AziMD Skincare have done that for you. We've come up with all these different regimens, whether you have acne sensitive skin, acne oily skin, or looking for an anti-aging regimen, but you've got, normal combo skin, discoloration, rosacea, sensitive skin, you name it. We have come up with all these skincare regimens so you don't have to do a lot of thinking. You just follow the steps.
Click.
And they are
Add to cart.
literally 3 steps in the morning, 3 steps at night. It makes it simple. And trust me, your skin will be so happy. Go spend money on like other things. You don't need to spend a ton of money on skincare.
I love that.
All right, guys. Well, I think we have so many more questions.
Oh, we have so many more questions.
Do this? I mean,
you guys are going to have to stay tuned for
go.
part 2, part 3.
Yeah. So I think we're going to save the next set of questions for part 2.
Yes.
I'm so excited, guys. Don't forget to tune in next week. We are going to be answering more of your questions. And if you're on social, follow us at More Than a Pretty Face Podcast. And send us an email if you're not on social at More Than a Pretty Face Podcast at gmail.com. Thanks, guys, for tuning in.